Welcome to the Healthcare Unfiltered Express, where I conduct short video interviews packed with relevant and timely information that you cannot miss. So sit back and enjoy the show. Well, it is Healthcare Unfiltered Express. I have a first timer. And Ray, you have to understand that nothing stops me from taping on Healthcare Unfiltered. Even when I have no voice, I will still tape.
So it's funny. I was about to say that you're not only sick right now, but you're also flying out. And
Yeah.
somehow you're able to squeeze me in. I really appreciate that,
Well,
Sean.
because it's a very important topic. And yes, indeed, we are taping this actually as I'm battling some cold and I'm heading to the ESMO meeting in 2025. But I really wanted to bring you, Ray, because I felt this is a topic that we just can't wait on. First of all, let's just start by introducing you to folks who don't know you. I've known you for many, many years, but there are a few people who don't know you. So, who is Ray Rao?
Yeah. So I'm a recovering oncologist, and I'm now a tech. I'm a tech bro, I guess. But I'm on the care delivery side of things. We have Ankr Health, a company that helps with medical front office augmentation using AI agents and all the good stuff for healthcare organizations nationwide. And so again, as part of my day-to-day, I started hearing a lot about how some of the things that are happening in the government shutdown, the hottest topic of the month, are affecting patient care in ways that I just couldn't find acceptable. And so I said, we got to jump on, we got to have a conversation, because if we don't act now, this would be a good lever point to start acting.
For
And
sure.
there's a lot that needs to be done. So
For sure. But Ray, tell me what Ankr Health does at its core. What is the company that you formed? What does it do?
yeah, so in the Ankr basically is a medical front office augmentation platform. What that means is, imagine whoever is in your medical front office, right? It could be a medical assistant, a triage nurse, a scheduler, a scribe, whoever that person is. Ankr helps them do their job better and offload some of the repetitive tasks from them. So our claim to fame in the market is we actually help convert a lot of the high value, high burden phone calls and messages into telehealth visits. And that's where we started. Now we convert a bigger portion of that into telehealth and in-person visits. So this is something that we've done for a number of years. We're actually pioneers in this space. And so we've seen firsthand how access with better technology can actually improve outcomes. Our patients get the same level of care, same or in many cases better care, faster, not just by hours, by days. These patients get their scan results faster, get their conversations done faster, get help after surgeries faster, all of it, while we improve care delivery with our partners. So our partners can, their staff can take care of 3 to 4 times more patients per human being in the clinic. That's the value.
And it's really fascinating. Obviously, you were one of these partners back in the day, treating patients every day. And I think we start getting a lot of appreciation to the importance of healthcare delivery science,
Mhm.
because there's one element when you be in the room with the patient, but the other element is how do you deliver from A to B? It's fascinating.
Absolutely. You'd be shocked. I was, when I found out that an average doctor in private practice or academia needs 5 support staff members to run just a clinic. I'm not even talking ORs. I'm not talking procedure rooms, just their clinic. They need 5 people around them. And those people are hard to get. Those people have gotten 40% more expensive in just the past few years since the pandemic. And even when you get them, the staffing shortage is so bad that half of those front office people leave within the first year. So you hire with
So
a
you're
lot of
trying
work.
to automate that. You're trying to automate a lot of that.
Not automate who exist, augment those who exist, because it's very hard to find them, pay them right, and keep them.
And how do you augment them? Like, how do you provide them tools? How do you actually provide the augmentation piece? Because that's really a very important part of the conversation.
Yeah, so I don't want to kind of go too far away from our
Sure.
theme of
Sure.
the day, but imagine Mr. Jones. He saw his urologist a week ago for blood and urine. He got ordered a CT scan. Now the scan's back. Federal mandate is you got to release the test result to the patient the same day. So Mr. Jones gets his test result on Monday. He calls his office, calls his doctor, and says, "Hey, I want to talk to somebody about this scan because it shows this mass. What is this? Do I need surgery? Do I need something? Is it cancer?" That patient right now has to wait an average of several days,
Yeah.
and the staff member that's answering the call, it may just be their first month in urology. They have no idea. They're a medical assistant. They may have spent their life in neurology or like a completely like family medicine. They may have zero idea what to do with this patient. So they go back and forth with the doctor. The doctor is already busy. That's the system right now. That's why it's broken. What Ankr does is when Mr. Jones calls, Ankr's agent, Mira, who's an AI medical assistant, she jumps on the call with the actual medical assistant in the clinic, and she helps that real human being find the relevant reports, find the relevant office notes, the relevant test results, puts it all in a nice little package in front of her so she can help make faster decisions on whether this patient needs an office visit or not and how soon, and then she can that person can just one click a button and our AI scheduler kicks in. They find the best slot automatically. They also record the whole conversation and send it to the doctor, so doctor has a full detailed record. It just makes everything
That's
more.
amazing. That's
Yeah.
amazing. So government shutdown and telehealth. Tell me exactly what has happened over the past couple of weeks, the broader impact on telehealth from the government shutdown and other factors.
God, so yeah, any day that I wake up talking about government shutdown is not a good day, right? But this is one of my favorite topics, because what got this to a five-alarm fire in our heads was when we started hearing the magnitude of disruption from this government shutdown. So we have a customer that serves about 3 million lives in the state of Virginia, and they're having to cancel hundreds of telemedicine appointments a week. And I started thinking, if this goes on for a month, just this organization, just one location in one state for one specialty is going to end up canceling somewhere around 2,000 appointments. Who are those 2,000 people? Many of them are like Mr. Jones. They have a scan result and they were going to have a Zoom call to go over it. Now they have to drive. Do they have somebody to drive them in? If
So
they
why, so
don't,
why, why are they being canceled? Help us understand why are they being canceled?
because telemedicine flexibilities ended on September 31st. So now your doctor no longer gets paid for what would be about, 2,000 appointments is what, 20,000 minutes or 40,000 minutes of work. So that's thousands of hours of work you're asking the doctor to give away for free. That's just not going to work. That's not sustainable. So what the only option that the doctors have, they obviously aren't going to say to the patient, hey, you're going to have to pay everything out of pocket. So they're not going to say that. So they're just going to say, hey, I'm sorry, but the government for Medicare patients took away the flexibility. So now you have to drive in. You have to come in to see me.
Was that taken away because of the government shutdown specifically, or was it going to be taken away regardless whether the government shut down or not?
The government shut down because the parties in power and not in power couldn't agree on funding the government. Part of the government is Medicare, CMS, right? So Medicare patients had a set of flexibilities to see their doctor from the comfort of their homes. And those flexibilities were tied to funding, to continuing resolution and budget. So because there's no budget reconciliation right now, those flexibilities have ended.
So it's basically was an item, was a budget item on the actual
Exactly.
thing. So
It was one of the millions of things on the docket, but it got cut. And I can tell you, we've spoken to senators and representatives extensively over the last couple of years. I can tell you, none of them would be happy if their parents or if their grandparents couldn't get in on a video visit, right? So this is something that may not be at the top of their mind, but it is affecting their families as well.
what can be done? Do you think when the government opens up and they have an agreement that this could be resolved, or you think it may be scratched? Like, are there efforts that could be done to make sure that stays top of mind to be able to handle it?
So again, I want to emphasize to your listeners, and hopefully that this reaches the senators and the people in power right now. I think it will, and we will make sure that our voices get heard. But we're projecting that over 1 million lives are going to be affected because telemedicine the flexibilities were not extended in just 1 month. So if this drags on beyond a month, it's going to affect millions of visits, millions of patients who need care, who could get care from the comfort of their chairs in their homes, will now have to take 2 hours off work, drive to their doctor's office for the same 5, 10, 15-minute conversation. That's not acceptable. I was thinking about it on my drive over. Who's responsible for this? Who should I be angry at? And hey, I never get angry, but it's not the administration. It's not one party or the other. This is a problem that's been going on for the last 4 years. Every few months, every year, multiple times, sometimes in a year, this exact issue of telemedicine flexibilities not getting preserved. This comes on the docket for Congress. It's been happening for many years now. I think if I remember correctly, it's happened about 10 times over the last 4 years. So this isn't, everybody's been punting this ball. It's not acceptable. The funny thing, Shadi, is this is one of those rare instances where there's an overwhelming bipartisan consensus.
Hmm.
Everybody on both sides of the aisle want to extend telemedicine, not just flexibilities, telemedicine coverage, telemedicine eligibility, telemedicine reimbursements.
So Ray,
Everybody sees that this is a good
yeah.
idea.
So then when you talk to policymakers, you talk to senators, congressmen, congresswomen. I mean, you see reception that they want to do it. So is it just a matter of time, and you think this is going to work, or do you think there's really a true risk that this could completely not be renewed, I guess?
There's zero chance that it won't be, like, at least in our minds, and there's a lot of kind of lobbying around this subject. So I can say with a fair amount of confidence that telemedicine is going to be preserved. Those flexibilities will get enhanced. But the problem is, you have these breakdowns every few months, or maybe every, once or twice a year. An office administrator doesn't have bandwidth to deal with this. So overall, you'll see, if this pattern continues, you'll see that community doctors, health systems will start to move away from telemedicine. If you look at what happened between COVID and now, the telemedicine use went from 40% at its highest to about 5% now. So patients want this option, but if you keep, going back and forth on whether the doctor will get paid or not, the doctors and the office administrators and the health systems will stop giving this option to patients. So it's bad for the society. I will say we've worked with a lot of members of Congress in this session of Congress and the last session. I want to point out a couple of progressive pieces of legislation that have bipartisan consensus, and they've passed through committee votes in last session of Congress, again, with full consensus. One of them is Telehealth Modernization Act. This is one of my favorites. It's sponsored by Representative Carter and Representative Dingell from Michigan. Carter is from Georgia, and Dingell's from Michigan. It's one of the most progressive pieces of legislation in this area, and it's going to extend the flexibilities for 2 years is going to do the right thing. There's a whole list of other really nice legislations. I can send you the link for your listeners, but there's no doubt that this needs to be done. There's no doubt that Congress is in support, bipartisan support. It's just a matter of getting it over the finish line. And I think that's what this shutdown is about. It's about making our Congress people realize that now is the time.
Right. Thank you so much for this. Any final thoughts you want to leave listeners and viewers with?
Yeah, call your congressman. Look up the list that I'll send to Shadi, or look up the Telemedicine Modernization Act. Call your congressman, local congressman. Again, it's almost guaranteed that that person who represents you in Congress, in US Congress, already supports this legislation. So as soon as the shutdown's over, get them to actually make it a bill. Right? Call them.
Ray Rao, thank you so much for coming on Healthcare Unfiltered. Really appreciate it. And as the more I talk to you, the more my voice is going to go away. So thank you so much for coming on.
Shadi, thank you for addressing this timely issue.
Thank you for listening to this edition of the Healthcare Unfiltered Express. Until next time, take care.